Welcome to KQED Newsroom. I'm Thuy Vu. Coming up on our program, a closer look at Proposition 61, a ballot measure aimed at lowering prescription drug prices. And author Josh Levs explains why paternity leave is critical for business and society. But first, several wildfires have been raging across the state. A wildfire in Lake County, north of Napa, has displaced hundreds of residents and burned about 4,000 acres. And this week, Governor Jerry Brown declared a state of emergency in Southern California for a devastating blaze that has sent more than 80,000 people fleeing their homes in San Bernardino County. While wildfires in California are nothing new, experts warn they may be getting more frequent and intense. Joining me now to explain why is Scott Stevens, a professor of fire science at UC Berkeley. Welcome.
Thank you.
Well, so far this year, we've seen hundreds of square miles of acreage burned in wildfires in California. How does this compare to previous years?
Southern California and Central California are ahead. I think we've had a real dry period in Southern California. We had an El Nino year. Usually it means 150% precipitation in Southern Cal. This year they got about 70 or 75%, so very dry. So they really are ahead. They have really dry conditions. North of the Golden Gate, we haven't had that many fires, but as you alluded to, there's a terrible fire in Lake County.
Will things get better as get worse actually as September and October roll around? Because that's when the hot Santa Ana winds actually kick in.
That's right, and we go later into the season, we would expect worse conditions, especially in Southern California. The Santa Ana has come in October, November, really severe winds out of the east. That's their worst season.
California has had 5 years of drought. How does climate change exacerbate drought conditions and the fire danger that come with that?
What it does is it really increases the temperature. So we do have drought, just like you mentioned. We've had droughts in the past, but we don't have hot droughts as much as we do today. So the hotness of the drought causes vegetation to dry faster, fuels to dry faster, so it predisposes the fuel bed to really more flammability.
So what are we looking at now? Is this the new normal with all these intense fires occurring more frequently?
There is in some ways, especially in the shrublands. The shrublands are really a problem because they burn every 25, 50 years or so. They burn episodically with high flame lengths, and they burn kind of stand replacement. So those systems really are predisposed to these really big fires that burn big. And yes, climate change is going to make that more difficult, more drought, more variability. The forests are a different condition. The forests, you can do some things to them to actually predispose them to reduce the potential for bad fire and bad fire effects. You can't really do that in shrublands.
Why can't you do that with chaparral, for example?
Chaparral, if you can't underburn it, you can do some treatments to it, like masticate it. You can chip it and do some things like that. Sometimes that has some real bad ecological consequences, like non-native plants increase. So when you try to do work with it, you can burn it and actually cause a mosaic of vegetation, but under severe conditions like Santa Ana, even the mosaic can be overdone by the wind.
So from a forest management perspective, what can be done to reduce the impact of wildfires?
What we need to do is restoration at scale. What that means is essentially trying to reduce the density of trees, reduce the density of maybe shrubs. The surface fuel, the wood on the ground, we want to reduce it. We want to get it to a point so when it does burn, or we have a 5-year drought, essentially maybe 70% of the forest survives. So actually the forest continues, evolves, all that goes on, instead of having these large mortality patches where we lose everything. So we're going to work on the forest before the fire, before the drought, so we can set it up to be more resilient.
And trees do have an incredible amount of survivability when it comes to fires. You brought an example of a tree. Show us what the rings on it demonstrate.
Sure. This is a ponderosa pine cross-section from a piece of wood just outside of Quincy, California, northern Sierra Nevada. And what this shows essentially is a sequence of injuries. The injuries are actually recorded for individual fires. So the fire comes and burns at the base of the tree and actually causes an injury, small lesion. The lesion is recorded in the tree ring. This particular tree has about 20 different fire scars. It survived 20 fires, but in its lifetime, the first one is around 1650, the last one around 1850.
So what does this tell us about how we can do controlled burns?
What that tells us is we go into these sites and we start to manipulate them by burning or even thinning or combinations of burning and thinning. We're right inside the ecology of the organism. It's actually an organism that's really adapted to frequent disturbance, so we can go in there 5 years, 15 years, work with it, reduce density, do some burning, and we're actually right inside the ecology of the ecosystem.
So is the U.S. Forest Service doing anything now to update its forestry management practices?
They are. Right now in the southern Sierra Nevada, we're going through a land management revision process. This hasn't happened since 1985. In 1985, yeah, that's right. In 1985, they haven't been revised, and climate change wasn't even on the radar then. So now the Inyo, the Sequoia, and the Sierra National Forest are all going through a land management revision, and they're thinking about resiliency, they're thinking about climate change, they're thinking about fire, and they're trying to come up with a way to manage forests to reduce their vulnerability.
Well, in your research, you have said that that type of forestry management, they need to do it 10 times the level of what they're doing now. Is the plan they have in place good enough to achieve that?
I think it is. The plan, I've looked at them, they're really looking forward. They're thinking about managing lightning fire in remote areas to get more fire on the ground ecologically, thinking about restoration. And you're right, 10 times kind of the current level is really the back of the envelope calculation. And sometimes people think that's nuts. But if you don't start to change trajectory on these forests and begin to build resiliency into them, integrated, we're really going to set ourselves up for really, really catastrophic outcomes into the future.
And, you know, we've been seeing a lot of footage of the fires here as you've been talking, and you have to feel for those families, the tens of thousands of families that have had to evacuate their homes because of wildfires, especially bad in Lake County. They just saw the same thing happen last year. How should land management strategies change to mitigate the loss of life and property?
That is a real challenge because the way we built in our environment, frankly, doesn't take fire into account. You know, so that's kind of a sad thing. We have houses dispersed in Ponderosa Pine Forest, Chaparral. What we can do today is try to get people to revise their outside of their houses with flame-resistant materials, try to reduce the vegetation near your home, try to make it less vulnerable to ember attack, because the embers are coming in from the wind and actually starting small spot fires. So you're going to try to do things to reduce that vulnerability. The other thing we can do in the future is better land management planning, land use planning, try to put houses in places that are less vulnerable to fire. So that is a real effort for the entire state.
So what happens in 20, 30 years from now if we don't do anything about this?
I think what happens is we continue to chase our tail. And it gets worse because I think eventually we're going to have so many large fire, the Rim Fire, the King Fire, the Sierra Nevada, they really begin to fragment our landscapes. That makes us very nervous for wildlife habitat, carbon sequestration, all sorts of things. So if we don't really change trajectory, in 30 years, I think our kids and our grandkids will have a different experience. Forests will be more fragmented. They'll still be forests. It'll be low density, lots of shrubs, lots of standing snags, less forest cover. It'll just be a different environment. But essentially, we have to. That's why I think we have 25 to 30 years to begin that transformation.
Are you hopeful that we can make that transformation? I'm
very hopeful. I really am, because the research we have today shows that we can do it inside the ecology. We've shown that, others have shown it. And I think forests are so important in this state. They're so important for water, wildlife, carbon, aesthetics, that we can't let them kind of go to the back. We don't want them to actually go negative. So I am hopeful. I think that the people of California and the managers of California Forests really want this to happen, and I'm hopeful it could happen. All
right. Scott Stevens, thank you for that explainer on wildfires and the science of it all. Scott Stevens, UC Berkeley Professor of Fire Science.
Thank you.
Well, on to politics now. A look at a ballot measure that tackles prescription drug pricing.
Let's send the greedy drug companies and the rest of the country a loud message. No more profits over patients.
Look into the facts about the misleading state drug contracting initiative, and you'll see that it's a problem masquerading as a solution.
Every year, the state of California pays billions of dollars for prescription drugs for retired public employees, low-income residents on Medi-Cal, and prisoners. Proposition 61 aims to lower the price of those drugs. KQED senior editor for politics and government, Scott Shafer, has more.
Proposition 61 on the November ballot would prevent state agencies from paying more for prescription drugs than what the U.S. Department of Veterans Affairs pays. The VA is allowed to negotiate for lower prices on behalf of roughly 9 million veterans. Joining me now to discuss the pros and cons of Prop 61 are Roger Salazar, spokesman for Yes on Proposition 61, and Kathy Fairbanks, spokeswoman for No on Prop 61. Welcome to both of you.
Thank you.
Roger, you're in favor of this. How would it work?
Well, basically, it's very simple. You know, all the measure does is simply tie the amount of money that the state of California pays for the prescription drugs that it purchases as a payee to the same price, to the lowest price of what the U.S. Department of Veterans Affairs pays. You know, this is a starting point. You know, I think Californians are tired of high drug prices, the price gouging that's going on by the drug industry. So this is a first step in trying to rein in those drug prices. And And frankly, it's something that the legislature or the Congress has not done. So the Californians are going to try and take this upon themselves.
You say it's very simple, and yet the legislative analyst who has to explain all this and analyze it says it's not simple at all. In fact, there are a lot of aspects of it that they're not sure how it's going to be implemented.
Well, so, I think some of the uncertainty that they feel is based on the threats that are coming from the drug industry. The drug industry is threatening to raise prices, so therefore that creates uncertainty. The drug industry is threatening to pull out. Again, these are things that are not in the measure, but are threats that we're hearing from the drug industry.
But it's also based on the information the VA has to give, and it's unclear whether the state can get that information.
Well, there's nothing in the law and even under federal law that prevents the VA from showing what their prices are. In fact, we've done it through our Freedom of Information Act requests. We've been able to do so. So there's nothing in the law that prevents them from doing that. And we think that anybody who says that you can't get it, is simply not wanting to put in the effort and the work to do it.
Kathy, a huge amount of money has been raised to defeat this, some $70 million more than any other ballot measure for or against. Why do the drug companies feel so strongly? What is the threat exactly?
Well, there's a whole bunch of threats, and you pointed to a few. I mean, it's not just the industry that's engaged. It's more than 130 other groups representing doctors, patient advocates, veterans, taxpayers, civil rights groups, business groups, labor unions. All are opposed to Prop 61 because it is very complicated, as you pointed out.
But the vast majority of the money comes from drug companies.
That is true. That is true. And imagine, I mean, this initiative would upend agreements that pharmaceutical manufacturers currently have with the various state healthcare programs, possibly with the VA. It's a market shift, and it would require the industry to renegotiate a lot of those contracts, and it threatens the relationships that some of the companies have with the state. And the most important part, though, is the loss of these contracts.
Well, it threatens profits, too, for the drug companies, right?
Well, I don't know that I'd say that. I think it's more that this changes the way the marketplace works. I mean, when you think about what the VA program was created for, and Roger's right, it is a program, or the VA gets low prices for pharmaceutical drugs. It was created as a special program just for the VA. It was never expected to be expanded to other agencies.
But why shouldn't it be? Because how do consumers benefit when the government can't negotiate better prices as they do in other countries? The U.S. is one of the few countries that can't do that.
No, the state of California does negotiate with pharmaceutical manufacturers for drug prices. They negotiate very heavily. The Department of Healthcare Services, which oversees Medi-Cal fee-for-service, they negotiate very heavily. CalPERS negotiates. The Department of General Services, which oversees for the prisons and local hospitals.
But the federal government, for the Affordable Care Act, for example, and the prescription drug expansion under President George W. Bush, they're prohibited, right? The government is prohibited.
I don't know that that's the case. I know that they've said, okay. Well, it doesn't matter. I mean, this isn't going to affect the federal government. It's not going to affect those programs. It's going to affect Californians.
So one of the claims that your campaign makes is that if this occurs and if these prices are linked to the VA, that prices are going to go up for veterans. Now, there's nothing in Prop 61 that says that, correct?
That's correct. That's correct. But this program, the same type of thing, extending VA prices to other agencies, was tried in the 1990s, in the early 1990s, under something called OBRA. Prices to the VA went up. Congress later repealed the law because of that.
But why would they go up? I mean, if basically you're saying that the drug companies would raise prices on veterans, right?
It could happen. I mean, we're not saying that it will happen. All of this is, as the LAO pointed out, a very complicated issue, and it depends on the negotiations between the companies, the state, the VA. I mean, one of the things we haven't touched on that the LAO touched on was the fact that the VA prices that Prop 61 is linked to aren't even public. Now, state law, like Prop 61, which is a statutory initiative, can't override federal law. So it's not true that the prices could become public.
I mean, some of that information is protected, and there are exemptions to the Freedom of Information Act.
Right.
Yeah, but we were we were able to through FOIA able to determine what those prices were. Now, now, yes, we have, and again, I think what's interesting to me here and look, we understand that the drug industry is going to be spending upwards of $70 million, some say up to $100 million to try and defeat this initiative. It's not because they want to see lower drug prices. It's not because they're afraid not enough people are going to be covered by this thing. It's because they're afraid that this is going to basically start, a tide, from California all across the country.
But there are also a lot of patient advocates groups, HIV groups, and all kinds of diseases, diabetes, and they're concerned that it's going to have a negative impact on them, right?
Well, and again, a lot of it's due to the fear mongering that's being raised by the drug industry and saying that then they're threats that they're going to raise prices, and also, to be quite frank, a lot of it has to do with the fact that a lot of these groups are beholden financially to the drug industry. I hear the arguments from the drug industry where they say, look, not enough people are covered by this thing, and I just think that's ludicrous. The drug industry arguing that they're opposed to a drug price relief measure because not enough people are being covered is like the gun industry, the NRA saying that they don't like gun control because not enough guns are covered. It's just ridiculous. I mean, not credible.
Yeah, and Kathy, there was an effort in the legislature that died actually this past week to bring more transparency to drug prices and require drug companies, for example, to explain to the legislature when drug prices go up. That bill died in the Assembly, and pharma, the big drug companies, opposed it strongly. Why would they oppose transparency? Well, I don't work for pharma. I'm working for the coalition opposed to Proposition 61.
But that's who's funding the campaign. But I can't speak to that bill. I didn't work on that bill. I can tell you, though, that the supporters of that bill made it very clear that they intend to come back next year and the year after that and the year after that and try to move another bill similarly through the legislature. Now, I would argue that is where policy ought to be done. I mean, this is what's wrong with Proposition 61. You've got one entity, the AIDS Healthcare Foundation, bankrolling the entire thing. They had their lawyer drafted up in secret, didn't show it to anybody before it was put on the ballot. Certainly it wasn't shared with prominent AIDS and HIV groups. I know that. And there's no opportunity to identify flaws like there is in the legislature. Yeah. How would you advise, how are you going to convince patient advocates and people who have diabetes and HIV and kidney disease who are concerned about this that they should vote for it? Well, I think,
we have to have a starting point from this. And again, the examples that you just mentioned about in the legislature where they couldn't even pass a transparency bill. How do we think that we're going to be able to pass a drug pricing bill in the legislature if they can't even pass something that just deals with let us know what the costs are and how you come up with your costs. So I think one of the things that we're going to be doing as we talk to voters, and first of all, they're already with us. When all of the polling that we've done shows that this has upwards of 70% approval from the voters. They are sick and tired of these high drug prices, and this is, if we can convince the voters that this is a start in lowering those drug prices, then they're going to be with us. Kathy, wouldn't you agree that, as a consumer at least, that drug prices are very expensive in many cases? I mean, there's Gilead had a $1,000 a pill, hepatitis C drug, for example. I mean, those kinds of things make a lot of news and fuel support for things like this, don't they? I think that's a very good argument to make for the Yes on 61 side. Certainly tap into people's concerns about higher health costs. The thing that we haven't heard yet, though, is how will Proposition 61 work in the real world? How will it lower drug prices? The LAO has acknowledged that the Medi-Cal fee-for-service, the largest state program covered by Prop 61, could face higher costs. Not lower costs of Prop 61, higher costs. Well, and again, that's because they're worried about the threats of the drug companies increasing the prices. No, we believe that if we can have an impact at the beginning with just first of all, the state of California pays $4 billion for prescription drug prices. If we're able to get the same discounts that we get from the VA, which is about 20 to 24% discount, that saves the state about $1 billion a year. And that kind of pressure, and that's going to lead to other state agencies wanting it. It's going to lead to private entities wanting it. And it's going to lower costs overall. We've got less than a minute left. Best argument for voting yes on Prop 61? Well, I think, like I said, Californians are sick and tired of these high drug prices, and they're tired of their leaders not being able to do anything about it. Here is an opportunity for Californians to be able to take this matter into their own hands by voting yes on Prop 61 and lowering drug prices. Kathy? It's not going to lower drug costs in California. It could lead to reduced access to medicine for some patients, especially in the Medi-Cal fee-for-service program. Could lead to litigation against the state of California because there's no implementation language in Prop 61 at all. It's overall bad for the state of California. Complicated issue. Voters have about 80 days to figure it out for themselves. Hopefully this will help at least get them asking some questions and maybe give them some answers as well. Kathy Fairbanks, no on Prop 61. Roger Salazar, yes on the measure. Thank you both very much. Thank you very much.
All right. Thank you, Scott. Well, in this presidential election year, paid family leave has emerged as a top workplace issue. In the run-up to the Democratic nomination, both Hillary Clinton and Bernie Sanders called for a federal program providing 12 weeks of paid family and medical leave. And before he dropped out of the race, Republican Senator Marco Rubio suggested tax credits as an incentive for employers to offer paid leave. But in general conversation, when people talk about such policies, they're usually referring to maternity leave. Our next guest is working to change that. Josh Levs is the author of All In, which focuses on how our work culture fails dads. Josh, welcome to the program.
Thank you so much for having me, Twee. I'm so glad to be here. Let's talk.
Let's talk about how we are currently doing as a society in addressing fatherhood in the national discussion over gender equity.
Oh, boy. Well, terribly overall, but it's part of the same problem. You know, when we talk about how America is the only developed nation that has no paid maternity leave, the flip side of that is that there are also all these pressures on dads as well to not be caregivers. What we have is a sexist structure. We built our entire work structure in this Mad Men era with a real Mad Men way of thinking. Women should stay home with babies, men should stay at work. So what I explain in the book is that we have laws, policies, and stigmas that are keeping it that way.
So while the workplace has changed, we have this traditional structure that people are working in that has not changed. And let's talk about the stigmas about men who take paternity leave. We reached out to viewers on Facebook about this topic, and it seemed to resonate with a lot of people. We had a number of men write in, including Joey Pavarnik, who says he actually got negative reactions from other men about his paternity leave. In fact, one co-worker told him 6 weeks, and I quote here, 6 weeks, I was back at work the next day.
Right. As though that's a good thing. Someone saying, right. So what we have are these recurring stigmas that have not gone away in the American workplace. And the strange thing is, by far, the vast majority of today's dads actually do value family over work, value family over money. Unfortunately, the few who don't keep getting raised up the ranks in the workplace, and the reason is that we have this work culture that still is based on this idea that if you're a man, you should keep working, and that women should then stay home. So these cultures are actually making it so that even when paternity leave is available, which is rare, the vast majority of it goes unused. So part of the problem is making sure that the stigmas are no longer there, that people in the workplace aren't thinking that they're saying something great about themselves by saying, go me, I came right back to work. You should never take pride in turning down paternity leave.
And this is all happening at a time when more and more women are breadwinners as well. You say that it is important for companies to embrace fatherhood.
Crucial.
Why?
It's crucial. So when you embrace fatherhood, I mean, look, one of the things that I talk about in this region out here is the importance of raising women up the ranks, right? And it's something that the tech sector talks about a lot. In general, in America, there are very few women leaders, very few women executives. Well, the reason is that we have these sexist structures. And what we need in order to fix this is to make sure that we're embracing modern fatherhood. So let's make sure in the workplace that we have policies and a culture that encourages men to also be the ones to stay home, to get flexible schedules, to take care of their children. The more you do that, the more you'll have real gender equality in the workplace.
So what are the barriers? I mean, you just made a point that even when the paternity leave policies exist, a lot of men choose not to take them. Why? Are there negative consequences?
Yes, absolutely. And there are men in my book, you wouldn't believe the things that happened to them. One guy took paternity leave and really in a horrible emergency situation. And when he came back, he was demoted and then fired. And ultimately, in a deposition, his bosses admitted they had a traditional macho view. Even, you know, I had a legal situation and what I faced at CNN, and my legal case even involved the same idea. The workplace.
Tell us about that.
Oh, sure.
How you got involved in this topic.
Sure. So, you know, I was a reporter at NPR and then CNN, and at CNN I was a fact checker, and then I started covering fatherhood and doing segments on it. And then I had a switcheroo. I became the dad in the news because there was this policy at CNN in which anyone could get 10 paid weeks to care for their child, except a dad who got his own wife pregnant, a man who had a baby the old-fashioned way.
What were the men given as leave?
2 paid weeks.
That was it.
So, but if I gave my daughter up for adoption and someone else adopted her, he could get 10 paid weeks. It's the whole idea that a traditional dad couldn't be caregiver.
So you challenged it.
I did, and fortunately, ultimately, they made the decision to change the policy, which was great, and there was a lot of attention that came from that. But when so much attention came to me and my family on this, I became fascinated as a journalist. Why are so many people interested in my story? Why are these women's groups and men's men's groups and business leaders talking about this, and I came to understand that we are all in this. Everyone who wants real equality is starting to understand that, yes, you have to focus on lifting women up the ranks, but you have to make sure that you're also giving men the chance to be caregivers.
So you're out in Silicon Valley a lot giving talks, and you interviewed a number of Silicon Valley executives for your book. How does the Bay Area fare in comparison to the rest of the country on family leave policies?
Well, the good news is that when I travel even overseas, I talk about the Bay Area, because the Bay Area, in terms of the big tech giants, starting to show that more parental leave, more paid family leave that's gender neutral is actually good for business. That is a fantastic sign. So that's happening out here.
And San Francisco recently approved among the best policies in the nation, 6 weeks of fully paid time off.
Right, and it's interesting because the state already has a model for paid family leave, which is what we need nationally, where people pay into an insurance fund, and it's not up to employers to pay. San Francisco has now called on employers to supplement, so it's 100% of pay during that time. But
Why do you think it's so hard to get a national policy on this? Because San Francisco's got one, California's got one that's more progressive. Polls show a majority of Americans support paid family leave. Why is this so hard to get a national policy?
And it's proven good for business, and most Republicans and independents and Democrats want it. It's hard to get it so far. I've been on Capitol Hill. The challenge is getting some brave Republicans to do what the Republican majority wants them to do, which is to support paid family leave. And right now, it's not really on the radar of Republicans. It's not that when I met with them, they're not so much against it as they are just not focusing on it or thinking about it. And what we need is true bipartisan consensus, like you had here in California, New Jersey, New York just passed this. When we pass that, we'll be helping families and businesses, and we'll be increasing profits and growing the economy. So it's really a necessity.
You talk about how much more progressive tech companies are than the rest of the country, but a lot of them are big and can afford this kind of stuff. What about the smaller businesses to give fully paid time off, 6 to 12 weeks? Won't it hurt their bottom line?
Well, no, but what I want is a system like what California already has for the state, and that is where workers are paying into a fund through a payroll deduction, and when they're off, they're paid through that fund. So the business doesn't have to pay them during that time. San Francisco's new decision is, unique. Most cities are not going to do what San Francisco did and telling employers that they have to supplement the rest of it. What we need nationally isn't a mandate on employers to pay people's salaries while they're off. It's to create the same idea, an insurance fund that workers have this payroll deduction that goes into. And when you need paid family leave to care for a child or an elderly parent or a sick spouse or yourself, you get that. Now that the figures are in, we know it's good for business.
Who does this hurt the most, the lack of a national consensus on this? And actually, even California's policy, it doesn't give you 100% pay for the time that you're off. So it seems like if you're in a traditional blue-collar or minimum wage job, these are the people who have the least resources, who need this kind of help the most.
They are. And there are people in my book, including right here in San Francisco, who are at the lowest ends of the economic spectrum. One of the biggest reasons we need a national paid family leave program, as I lay out in the book, is that it will help people who are at the lowest ends, anyone paying into Social Security. We also need to focus on things like transportation availability and living wages and making sure that there's affordable homes. All of those things factor in, but when it comes to this, it's important to keep in mind both fathers and mothers are suffering, and we can do better with these kinds of policies.
All right, Josh Levs, thanks so much for coming in.
My pleasure. Thank you.
Josh Levs, author of All In. And that does it for us. I'm Thuy Vu. Thanks so much for watching. For all of KQED's news coverage, please go to kqednews.org.